My name is Paul Brogan. I'm a professor of vasculitis and a consultant paediatric rheumatologist working at University College London in London and also Great Ormond Street Hospital for Children. I've been a paediatrician for over 30 years and I've had to use steroids, sometimes referred to as glucocorticoids, for many decades to treat a range of inflammatory disorders in children and young people. So steroids are very effective and very good for treating a range of different inflammatory disorders. However, there is no free lunch, and most of you will be aware, either from talking to your primary care physician or your specialist or even looking on the internet, that steroids can have many side effects that might be of particular concern to children. Many side effects of glucocorticoids in children, and certainly one of the more common and thankfully reversible side effects is behavioural change. You might sometimes have read on the internet that people refer to as roid rage. This is not the same as anabolic steroids that bodybuilders take and go crazy in the gym, but this is the effect of these very potent anti-inflammatory versions of steroids directly impacting on the brain. And it can happen to grown-ups, but it also happens to children. What a parent might notice is that within 1 or 2 days, even depending on the dose of the steroids administered, lability in their emotions, so very tearful or hysterical laughing in extreme cases. Sometimes children can become very angry for no apparent reason or for trivial reasons, and this can be incredibly distressing for the child themselves, who feels out of control, and certainly for the parent or carer and other family members who have to look after those children. The sorts of behavioural changes and mood changes can be from nothing at all through to mild depression or just not themselves, through to extreme examples of rage and confusion, to frank psychosis. And thankfully the more severe forms are rather rare, but what is quite common are the mood changes that enough for a parent to notice. What to do about that? Well, first and foremost, I think it's important that your physician will mention this to you so that it doesn't come as a surprise, such that if this does happen to your child, you can be aware and understand what is going on. Be reassured that it is completely reversible on reduction of the steroid dose. So like all side effects of steroids, you've got to use as much as you need, but as little to cause the minimal side effects. There's no specific treatment usually that's required. For very extreme cases, you have to really reduce the dose of the glucocorticoids under medical supervision. The problem with making too rapid changes as a parent by yourself is that you can cause harm by causing imbalances in the hormone levels that can cause the child to become more acutely unwell by taking away the steroid too quickly. So any changes have to be made under medical supervision. So it's really by having a dialogue with your physician about how much does my child need now, given that they're having this rather severe side effect, if that was to apply to your child, and to make these side effects, make your physician aware of those side effects so the physician can work with you to minimize the steroid exposure and hopefully limit the severity of this important side effect.